Hi, this is Dr. Topper, Global Pharmacovigilance Director at Oracle Health Science Consulting. In this first video, we'll talk about the elements of case processing. Now, I'm going to be talking about a typical workflow module. Yours may be more roles than this. It may be less roles than this, but this is the typical one. So there is a role for triage and data entry, taking in the source document and putting it in and verifying that it is a case in the safety database. That's data entry, we'll call. Second one would be case processing. This is where you create the narrative, indicate the verbatim terms into MEDRA terms, sequence them, call an SAE or keep it an AE, and fill in the various elements that would make up the health authority report. The next portion would be quality review. Now, this could be a dedicated function with a user group, or it could be something within the database, and we'll talk about that when we get to quality review. The next one would be medical review. Now, this is simply the physician or higher clinical authority within your company weighing in on the clinical aspects of the case, the chronologically of the adverse event flow, the medical MEDRA terms, and the overall seriousness of the case. The next one would be submission. So this would be the group that would create the letters that would go out to the health authorities. They would also help push the report from within the safety database out in a timely manner. It could be an internal timeline, it could be a health authority timeline. And so this is the user group that does that. So you have a 5-step typical workflow: data entry, case processing, quality review, medical review, and then report submission. In the next videos, I'll talk about each of these roles and how you can gain efficiencies back.